back into a recession mode. This will stimulate higher interest rates. Higher interest rates will crowd out funding in the federal government for initiatives that are needed. Keep this in mind. We cover in this region 58% of the total private market that is not covered by the government. Individuals, small groups, large groups of all sorts. The government, 74 million people are covered by Medicaid. Would be 80 million if the 19 states that didn't participate actually did participate in Medicaid. Medicare covers 60 million people. CHIP covers 10 million people. The exchanges that are heavily subsidized cover another 10. So when we talk about the private sector, understand that it fits within this much larger framework. What happens when interest rates start to interest demand on federal revenue starts to crowd out future investment in these government programs that provide access to health care for tens of millions of Americans. This occurs at a time when the demographics are not favorable. Population is aging. By 2030, all the baby boomers will be on Medicare. Another demographic trend, it has been mentioned, obesity. 30% of the US population obese. There are disparities. 70% of the total population either obese or overweight. Epidemic of diabetes, of heart disease, coronary artery disease, coming from those demographics. And the baby boomers will see these things in full flower in the next 10 years as they move fully into Medicare. The third mega trend is the congealing of the US healthcare system. I mean that in two ways, and this is aided and abetted by federal policy. Anywhere you go in the United States, you will see large integrated delivery systems built often around academic medical centers. In this area, there is Hopkins, University of Maryland, MedStar, Inova, Children's, very good quality care. 50 to 100% more expensive than the community average. Let me put that in perspective in just one way. Imagine a family of four, a father 40 years old, a mother 33, two teenage kids, and they bought policy from us on the exchange, and they didn't have any subsidy. They had to pay for it themselves. Have any idea what that would cost between the premium for the four of them and the deductible and coinsurance and copayment? $33,000. If it was all in Hopkins, if it was all in MedStar, if it was all in Inova, if it was all in UMS, University of Maryland, $60,000. So what these big systems are doing is consolidating community hospitals, independent physician groups, and they create what amounts to oligopolies. There's another thing happening in the specialty area, which is the roll-up of major specialties backed by private equity. We had the largest urology group in our area bought by a private equity firm. How do they make money? Increase fees. So what my point is this tendency towards going to large systems, integrated systems, while it holds hope, and there's really not an issue that I'm raising about quality, but there is a profound issue on cost. The fourth mega trend is the undermining of the private market, and I will underscore this with ACA. Just recently, to name a few, we have gotten rid of the individual mandate. the subsidies that were hopefully in the omnibus bill that just went to the president and that he signed for people who have low income, particularly minorities, was taken out of the bill. Alternatives to the Affordable Care Act were fostered, like short-term duration policies, basically policies that are 3 months long, but now were made for a year and can be renewed and don't have to live up to the requirements of coverage that the Affordable Care Act required, further undermining the private risk pools, cuts in funding for the exchanges. Fifth major force I would point out is that despite the innovation fostering under the CMMI programs, the whole idea was create a series of initiatives that might show the way for the future. ACOs and like do not show the promise yet that was intended for them. There is no new model that one could say is demonstrably more successful. So beware, I guess is my point, that as all the activities go on, as well they must, that you are not being pulled off the line of your course into a storm. There's a reckoning coming. I hate to say that as I leave to retire. Now, I would say that having been interested in my whole career in primary care, my son and I have formed and created 2 medical schools that train primary care physicians, one in Las Cruces, New Mexico, and one outside of Boise, Idaho, in the Mountain West, in order to help meet that need, and we think we can do some more. And so part of what I will do in retirement is to try to foster the creation of primary care, better primary care capabilities. But I can tell you, having lived here for 12 years and having been enmeshed in the entire federal and state scene, that these mega forces are shaping our direction in ways that are not obvious. Sometimes they are and sometimes they're not. And my message to you and to all of us and to me itself is to be vigilant about this. The reckoning is coming. Maybe change occurs only when there's a rip-roaring crisis. But we're heading to it. The funding that supports all the initiatives you just heard about is threatened. And we're worried about access. Nothing so threatens access to health care or the quality of health care as the cost of health care. It is the ingredient that, when present, cost cooks you. As carbon dioxide is to global warming, cost is to health care. We deal with it as a private carrier every day with 25,000 screaming employers that they cannot afford it, and individuals who rightly say they can't afford it, even with subsidies. And we face a future where the cutbacks in funding could really dramatically affect accessibility to care. Does that mean we move to more of a single payer? Some major repositioning? I don't know. But I'm here to tell you that in 35 years in this field, I have never experienced a time quite like this. And if I was to give you any message at all today, it would be that. Be vigilant. Be involved. Be committed to the serving of these populations. Last night, I stayed late in the Maryland legislature for a bill we have been working on in light of the lack of federal action to provide a reinsurance program that would hold premiums down in the individual market. And I believe that within the next few days, the legislature will pass a bill in Maryland that will provide $600 million in funding to subsidize the individual market in Maryland. But the funding source is very questionable over the long term. It would mean an enormous amount to the individuals in this market who live here, and particularly to minorities and those with low income, and we serve the vast majority of them. And I can tell you this, they are sicker. They do need the service. They absolutely need the access. And they need the funding to support it. And we are in a dangerous time when all of those things are threatened. So I personally want to stay committed and involved in this process and work towards solutions, not the least of which is to provide more access to primary care, a lifelong intent I've always had. So thank you for listening to this. I don't mean to discourage you. I mean to call you to action. Be aware that you are in the Gulf Stream of forces that are beyond the specific programs that have been talked about today so far. Thank you very much.